Doctors of Reddit, what's something you've had to tell a patient that you thought for sure was common knowledge? How a shorter/fatter 5 ml oral syringe held more volume than a skinnier and longer 1 ml oral syringe? How does this hold more liquid when it's shorter? Also, I've seen almost every incorrect way to use an inhaler, upside down being fairly common. People taking birth control pills only on the days they have. I no longer assume anything is common knowledge. I'd rather someone be offended that I explain something basic than to have something awful happen because I assumed the patient knew something. Isn't this a key part of developmental psychology? I forget the term, but knowing that different shapes of objects can have greater or less volumes. Edit, it's conservation, I get it people. I'm not a doctor, but I'm an ER nurse. I had a patient come in for an STD check. She was very upset and continued to tell me that she only had one partner. Progressing through my assessment, she further divulged that even if he was sleeping with other people it shouldn't matter because he uses it every time and he makes sure to wash it thoroughly after every use. I asked what she meant when she said he washes it after every use. She explained that he washed the with hot water and soap before he used said again. Straight face, I had to explain to her that are a one-time use product. She had no clue. Out of everything I've read so far, it's always the stuff that comes back to horrible ed that terrifies me the most, and this is probably one of the worst. Not a doctor, RN in the ICU. I've seen some really stupid people over the years, but a few weeks ago a patient's family member got into a verbal altercation with me over the fact that I was trying to freeze his mother to death. He kept pointing to the digital thermostat displaying a temperature of 23 degrees Celsius, we're in the US, BTW. When I gently explained to him that 23°C is not at all cold, he just kept pointing to the display and shouting, "You don't think 23 degrees is cold? It's 23 degrees in here." And acting insane. After multiple attempts to explain to him what Celsius is by myself, the charge nurse, house supervisor, and security, we finally gave up and had him escorted out. He was a man in at least his late 30s who graduated high school and had never heard of Celsius and Fahrenheit. He literally thought we were making it up in an attempt to conceal my efforts to freeze his intubated, critically ill mother to death. For some reason, out of all of this, the one part I'm especially stuck on is that he could stand in a 70-odd degree room and believe it to be 23°F, just because he saw that number on a wall. Somehow he knows 23 degrees would be enough to freeze his mother, but doesn't seem to take note of the fact that the air around him is not, in fact, freezing. FFS, even his skin is stupid. I know, right? My coworkers weren't fazed so much by the fact that he is dumb enough to not know what Celsius is or any of that, because we've all seen our fair share of stupidity, but the fact that he could be in a room that's almost 75 degrees and think it's cold. Not a doctor, but a nutritionist. I work with a lot of different patients, and I have tons of stories about food stupidity. Had a lady have bariatric surgery, your stomach gets surgically stapled smaller. And her mother kept trying to force her to eat real food the day of the surgery. When she was on a liquid diet, she would eat it, puke, rip her stitches out, repeat. We had to ban the mother from seeing her, because she would literally blackmail and guilt trip this poor lady into eating a whole pizza, barf it all up because her poor post-surgery stomach couldn't handle it, and end up ripping out stitches and causing enormous pain, because her mother was positive that she would die if she was on a liquid diet for a couple days. Another lady I was seeing for clinicals was diabetic, and she would come in every week with stupid high blood sugar levels, 250-560-ish, not knowing why they were so high. She kept a record of everything she ate, and all her food intake seemed fine. One day, her husband came with her, which was weird, and he ninja slipped me a note while shaking my hand. It read, "Ask her about the Quick Trip slushies. She doesn't believe me that they have sugar in them." So I asked her if she was having any soda, lemonade, tea, ice cream, shakes or slushies, and she told me, like a light bulb had gone off in her head, "Well, I have been drinking about 3 of the 48 ounces Quick Trip slushies every day for a while now." They're just so good. And they aren't tea food or drink, they're slushies. So they don't have any sugar in them, and I don't need to record them. It was so hard to convince her that those are so full of sugar it isn't even funny. But seriously. 3 a day on a type 2 diabetic. It was one of the stupidest things I have ever heard in my life. Good on the husband that he cares enough to try to explain, and when his words fail, having you do it without embarrassing her. Very much so. I was very grateful to him for doing so. She was ending up in the hospital every other day or so because she was drinking these stupid slushies all the time. I'm glad he saw it, and I'm glad that he came to the meeting. Not only did it actually help his wife, he started coming more often and letting me help him adjust to her diet also, and she mentioned to me later that it probably saved their marriage, due to the fact that all of a sudden he showed her that he was taking a direct interest in her and her life. It was a big turning point for me in feeling good about my job. A nursing home called 911 for a patient who was having difficulty breathing. When we arrived, a pa was standing in front of the patient vigorously fanning the old lady with her hands. She looked at us and said, "I'm giving her some oxygen because we couldn't find a portable O2 tank," and keeps flapping her arms. Remember, this is a physician assistant. Probably making 100K a year. I informed her that she could stop now, and my partner and I did our best to wait until we were outside to burst out laughing. Some people don't handle stress well. I volunteer as an emergency first responder, but one of the funniest cases I've seen of this was out of uniform in an airport. A larger gentleman who suffered from COPD had taken a 6-hour flight. Upon getting through security he had collapsed and was having difficulty breathing. The first person on scene to help the guy was a firefighter. I was second on scene, younger and smaller than the firefighter. I'm 6'3" and not skinny, this guy was just huge, so I'm letting him take lead as I run through making sure EMS is on the way, checking the guy's vitals, stabilizing his head and neck. Big guy, went from conscious to unconscious quickly and fell straight down, and getting a history from his family. In the meantime the firefighters kinda starting to panic a little. He may have been new, or just the fact that he was out of uniform and not expecting it threw him. Either way, as the man regains consciousness and I start running through a quick GCS test, which involves me and the gentleman talking to each other, and treating for shock, the firefighter tries to retake the guy's vitals. He fails to find a pulse. Understand, at this point I am communicating with the patient. He's not completely lucid, but he is speaking to me and groaning. Having failed to find a pulse, the firefighter assumes this gentleman is in full-on cardiac arrest and begins to attempt to apply an AED to his chest. I say attempt because, along with being large, this gentleman was somewhat hairy. Now in any first aid course, for anyone, that involves teaching one to use an AED, one of the things you cover is that the razor in the kit is there in case you need to shave someone. The firefighter, having failed to realize that talking probably means the patient isn't in cardiac arrest and that he is having trouble getting a pulse because the patient is larger, then fails to shave the guy's chest. This leaves the patient with the 2 contact pads hanging off of his chest hair but very much not in any way contacting his skin, while I've just started to realize what the firefighter was trying to do. At that point, fortunately, an older woman arrives and identifies herself as a trauma nurse, who are, by the way, just about the best people to have on your side if something like this happens. She tells him to go talk to the family, takes lead, and everything goes smoothly from then until the airport medical folks show up and take over. Unfortunately, I'm having trouble not laughing the whole time at the image of the firefighter, staring intently at an AED that can't possibly give him a reading on the condition of the now conscious and lucid patient. TLDR, even people who should know better sometimes lose it under stress.